I must be clear that the order that was issued this weekend does not change our policy or my advice. Reports that indicate otherwise are not accurate. No policy has changed since mandatory masking was announced on August 4th.
Now, the order says schools do not need to keep students, staff, and visitors 2 meters apart. Upset teachers call that a total reversal, but Dr. Dina Hinshaw says mandatory 2-meter distancing was never part of the original plan. Now, we have infectious diseases specialist Dr. Lenora Saxinger joining us from Edmonton because Dr. Saxinger, just on the face of what Dr. Hinshaw was clarifying today, that physical distancing will not be required in classrooms. Should parents be concerned about that?
Well, I think that there's a fair amount of anxiety around this, and I can understand that. I think the guideline, when you read it, doesn't say there will not be distancing. I think they're saying that no one will be measuring the distance and that they're suggesting it be as much as possible. But you have to remember that distancing is actually one of several things that are going to be happening in the schools. So the hand hygiene, the cohorting, the symptom screening, all actually should be useful, as well as controlling community spread is very important to reduce rates in school. And I think that there's a really strong impression that if a single kid comes into school infected but without many symptoms and doesn't get screened out, that there could be widespread infection in the school. And in fact, that would be the exception, not the rule. Even in households, we see about a 10 to 15% attack rate for people who live together with someone who's infected, and that decreased by these measures. And so I think that there's kind of a gray zone of evidence that we're trying to negotiate as responsibly as possible.
Right. Interesting insight into that. Dr. Saxinger, good to talk to you. And we'll talk to you a bit later in the program as well. Thank you.
Thanks.